Hi, I'm Dr. Thomas Swahn. Welcome to Swahn Balanced Health. We're going to do some pre-flight instructions, basically explain what to expect when you come in for a ketamine experience here. The first thing I like people to know, ketamine is a powerful psychoactive medicine. As far as the effects on the brain and body, there's a lot more effects on the brain than there is on the body. That's great for our purposes here. It's one of the safest medications that I would give during my time at the hospital when I was doing sedation monitoring. So I'm very comfortable with this medicine, and I really appreciate how safe it is. I'd like to talk about who ketamine treatment can be good for. So the current state of ketamine treatments is we're using it mostly for mental health, but it's also good for chronic pain. Some other neuropathic disorders can also be affected by it. There are some conditions that will increase pressure in the brain or eyes. People with unstable hypertension, so high blood pressure over a longer period of time. Later stages of heart disease, liver disease, kidney disease, anything like that can make it so we'll want to consider whether the ketamine treatment would be worthwhile for you or even safe. The good news is, remarkably safe medication. It's really safe for most everybody. But when you're considering coming in for treatment, we will send out some medical forms, have you do some background medical information for us, and then we'll look that over before the treatment to make sure that there's not going to be any surprises, any concerns, any considerations that we missed. As far as like medications that people need to hold before treatment, things that can interact, there's really very few of those as well. Ketamine treatment goes really well with standard antidepressants. There's not any that are a deal breaker when you're coming in for treatment. That being said, there's a few classes of mental health medications that can diminish the efficacy of the treatment. For clients that are on mood stabilizers, antipsychotics, or anything that's a central nervous system depressant like opioids, benzos, or even excessive amounts of alcohol, can basically dampen the effects of the ketamine. That's not to say that you can't take your normal medications. Obviously, ended up on those for a reason. But if you have any concerns in that way, then we'd be happy to discuss it. Ketamine is also really safe when combined with most of the nausea medications that would be helpful in a situation like this. So we've got a variety of medications in-house that we will offer for nausea, and we're able to cover that pretty well. Outside of that, the ketamine treatments are really safe for a wide range of people. For mental health, we find it most helpful for conditions where there's sort of a looping ruminating. You're just going over the same negative thought loops over and over. OCD is kind of the traditional characterized by that looping, but anxiety, depression, and PTSD are all also very well treated by the ketamine because they have a major aspect of that. A lot of people ask, what does the ketamine experience feel like? That's a really difficult thing to answer. Being able to go into this abnormal state, you see your own life differently. You're able to see that all the things your brain is very heavily convinced you of, that's not the truth. I mean, we are multitudes. Of course, we contradict ourselves constantly, but we don't need to be miserable about it. And so by zooming yourself out, you're able to see that none of that was really the big grand truth. You were just had your face pressed up against all your anxieties. The way we approach the treatment is we start off with a quite light dose. Some people are really sensitive, and so that will not be a light dose to them. They're why we start at a light dose. On the flip side of that coin, though, some people are really tolerant and will feel almost nothing at that starting dose. So we're going to give each client the opportunity to go deeper throughout the treatment. There's never any pressure to go deeper, though. If you feel pressured, if you feel like you have to go deeper to get those benefits, it's not going to be a good experience, and therefore it won't be as healing. We do see in the literature that deeper doses and deeper mystical experiences both correlate with better outcomes, but not at the expense of you having a positive and meaningful experience that you feel like you're a part of and can engage with safely. If you surrender to it, you give yourself out of the experience and let it be whatever it will. Let go and float downstream, they used to say in psychedelics. If you can do that, then any experience is beautiful. It can be healing, it can be meaningful, and it can bring you insights that you didn't know you needed. You just have to be open to them. At the end of the infusion, the ketamine will wear off pretty quickly. Over the first 15 minutes that the medicine's not coming in anymore, people will find themselves solidly back in the room. There will be some residual effects for a few hours for most people, usually about 2 hours. Some people through the rest of the day. The realization that ketamine can bring is really akin to waking up to all the factors in your life that you've let become too routine. You don't notice them anymore. And you know something's wrong, but you're not sure what. The ketamine will help you see that again. It's like a whole brain audit, like a reset. One of the things in psychedelic medicine that we really harp on is the intention. And so I have a little bit different views than some providers on the intentions. The basic idea of the intention is, why are you doing this? What do you hope to gain from it? What is your intent? I think that a simple intention works best with this. The intensity and strangeness and abstractness of the psychedelic experience means that if you have like 2 paragraphs to remember for your intention, you're not going to remember it. Along those lines is where we talk about the challenging experiences. A challenging experience, sometimes people will talk about it as a bad trip. They're really worried about if they're going to have a bad trip. Again, my first and foremost goal is to give you a positive and meaningful experience with the IV ketamine. If you get overwhelmed, sick, if you start tripping over into sedation, I don't think you're experiencing much at all, we're going to dial that medicine back. The nice thing about the IV is your experience will adjust to the flow rate within a few minutes. So if you get overwhelmed, if you're nervous, you're not sure if what's going on and your experience is okay, you can hit that call light, we'll come in, we'll stop the trip, we'll sit with you for 3 minutes. And you're already coming back. You'll be in a much better place. At the end of the infusion, when all the medicine's done, we'll take your IV out. We'll just let you sit and recover, let the medicine wear off for a little bit, 15 minutes or so. And then I'll come in and I'll check your vital signs. After we check the vital signs, we'll talk about how your experience was, talk about anything else you might need to know. We'll talk about any specific instructions for that day. Some general things to know for the ketamine treatment. The half-life of ketamine is just a few minutes. When we give it IV, that's why we can adjust it up, down, stop it, add more, whatever, because your body is actively processing that active ketamine out. The metabolite that we end up with, it's called norketamine. Half-life of that is 2.5 hours, and a half-life means that's how much time it takes your body to get rid of half of that load. So it'll get down to 25%, 1/8, so on. What I recommend after the treatment is that you go home, drink a little extra water, and then just don't do anything challenging or difficult or anything. Just do a lot of reflection. A lot of our clients will come in and think the ketamine's going to fix them, and that's not how it works. The ketamine wouldn't know what to do to you to make you a more effective human or happier. But what it does is it makes you changeable. Similar to putting a lump of metal in a forge. That metal comes out red hot and soft. It's malleable. You can change it into whatever shape you want. That's basically what the ketamine's doing to the brain. It's releasing a lot of the anchor points that make the brain rigid and opening a critical window again where you can change the structure of your brain. Now that lump of metal is hot, you got to shape it or else it's going to harden into that exact same shape and you'll get no progress. Seeing a therapist, they're an expert in that domain, so we recommend that heavily. But there's a lot you can do on your own. Any sort of contemplation helps a lot. That's really where the changes are going to come from. You're reflecting on your experiences in the ketamine journey, which are showing you parts of your life, and you're choosing if you want to be that. There's a couple of things I like new people to be warned of, a little bit of informed consent. Some people have really strange dreams after the treatment. Not a problem, but just a note. If you have strange dreams after, you're welcome. And then the other thing that we like people to be aware of is that some people after the first treatment will actually feel worse rather than better. We have noticed it seems to be a pattern of people that suppress a lot of their emotions. If you happen to suppress your emotions in your everyday life, the ketamine is like an emotional laxative. It is gonna set some stuff free. That's a perfect time to process grief, pain, trauma, guilt, shame, all the negative emotions. The ketamine zooms you out from that, and it's almost like emotional armor. It makes it less impactful, less heavy, less scary to deal with. If you do feel worse, it's just like first one sort of set something free, and that second one we're able to face it. For almost everybody, though, they're going to feel nothing but benefits after that first treatment. That being said, it's usually pretty short-lived, maybe a week. But for a few days, they'll have less reactivity to old triggers. They'll be more aware, more energized, more focused on everything in their life. The ketamine really benefits from repetitive dosing over a cluster up front. We call that the induction series. The standard induction series is usually done over 2 to 3 weeks, 2 to 3 treatments per week for a total of 6. After that, most people are in a really good place. Often we're able to achieve full remission for depression, anxiety, things like that. Some people need a few more treatments than 6 to really get in a robust place. Some clients come for a single one and are set for almost a year. You know, it really depends on the person. So with that in mind, to come in for that first one, we'll see how it goes. We'll figure out where your dosing threshold for meaningful and positive experiences are. We'll see how you do with the side effects. And then after that first one, come in a few more days. We'll see how you felt after it. We'll talk about how that first experience went, and then we'll come up with the strategy we want to do for the next dosing. When the ketamine treatments were first starting to be used for mental health, they basically were trying to limit psychoactive effects. And so they kept them all to 0.5 milligram per kilogram, trying to achieve a total certain dose over the 6 treatments. The repeated dosing actually has a unique benefit we can't get any other way. The analogy that I really love for this is like a snowy hill that people are riding sleds down. Each one of those sled paths is like a thought going down your head. After somebody rides a whole bunch of times down the same path, it's really packed, really slick, very efficient. It starts to filter and funnel other paths into it. That's basically a really strong rumination path in your brain. The ketamine is like a fresh snowfall on that hill. If you do one snowfall, it will make that, you know, really robust and welded down path less impactful, but still pretty heavy. But with repeated snowfalls, we're able to give opportunities for other pathways to get established. Even if the snow sort of melts and reveals that old pathway again, by the time that happens, there are many options. And you can see that there's other ways to be, other ways to feel, other ways to think. And the ketamine brings hope. It brings awareness of options, of possibilities, of futures, that you have choices. You have the ability to impact and drive and influence your life. I don't know. I just think that's really beautiful.